Hello, I am director of Dr. INOV Centre in Paris. I created this video to inform you about the errors that lead us to an epidemic situation and to inform you about the protection measure you should use. First, use polymer gloves, wear a mask, wash hands and gloves with soap, sterilize glove and mask at high temperature. Virus is killed at temperature higher than 80 degrees Celsius and by disinfectants. Coronavirus is airborne virus diffused by droplet spitting. Droplets can have different sizes that determine to some extent the survival time and distance of spreading. Macro droplets survive less than 5 minutes and spread less than 2 meters. Micro and nano droplets survive for a long time and can be spread over large distances. Virus accumulation on surfaces is due to droplet adsorption or direct deposition by contaminated hands. This image shows coronavirus in a droplet of saliva mucus and water. It is a nano-object of about 100 nanometers and can survive up to 12 days at favorable conditions. Damp areas are optimal conditions for virus survival, while dry, warm areas are less favorable and virus can survive from some hours to 5 days. The contamination probability is a play between the virus penetrability, virus concentration, which can be high on surfaces and in some closed areas, and also the time of exposure. The penetration pathways are direct droplet respiration or transfer by contaminated hands, food, objects in contact with mouth, nose or eyes. The virus is non-object that can penetrate in the epidermis and hair follicle that make it difficult to wash and can contribute to secondary transfer. This slide explains why virus propagation switch to an epidemic. The first reason is the asymptotic transmission prior to the onset of symptoms. The second reason are the errors due to neglecting of weak factors related to micro and nano droplet longevity, as well as the skin washing nano resistance. These weak factors contribute to lose track of patient zero. These are outdoor, indoor, micro and nano droplet respiration. Although they have low concentration, they have high survival time, they can spread over large areas by wind or repetitive exposure in stadium, bus stops, concert can contribute to increase the contamination. The other weak factor is the secondary transfer by the virus penetrated in the hand epidermis. The World Health Organization and government recommend to wash hands and use disinfecting gel to protect. The advice is good but has partial efficiency because we have habits to touch surfaces and thereafter to touch mouth, eyes and nose, or to place hands in the pocket that becomes source of contamination. On the other hand, the virus penetrated into epidermis of the hand shows a resistance to washing. The imperfect advice help virus to progress and a better solution is necessary, which can be first to use polymer gloves disposable or multi-use. Second, to wash hands and gloves with soap. And finally, to sterilize the multi-usable gloves for 2 minutes at high temperature. Gloves change our habits and protect directly the hands. With gloves, it's more rare to touch the mouth or to place hands in the pocket. The other advice of governments is not to wear a mask if you are healthy. However, this advice faces a problem related to long-lasting micro and nano droplets in the air that are carriers of virus. This is a major error that ensures the virus propagation. Better solution is to wear disposable or multi-use mask FFP2 or FFP3 or N95 in United States. If not available, make yourself mask of dense fabric. This mask is not perfect, but is better than nothing. Mark internal side and place it always face of your nose. This is very important. Also change the mask each 3 or 4 hours. Keep used mask and gloves in a closed bag. Thereafter sterilize used mask for 2 minutes at high temperature. Finally, to summarize, neglecting the micro and nano droplets as well as the possible secondary contamination by the virus in the epidermis lead to epidemic situation. To protect, use polymer gloves, wear mask, wash hands and gloves with soap, and sterilize gloves and mask.